In this video, I'll be sharing a scenario that shows how the four principles of ethics, autonomy, beneficence, non-maleficence, and justice come into conflict during clinical decision making. Our case begins with Maria, a 17-year-old pregnant girl diagnosed with severe pre-eclampsia. Her blood pressure is dangerously high, and the healthcare team recommends an emergency C-section to protect both the mother and the baby. But the moment the doctor informs her, Maria refuses. She says she wants to wait for the baby's father to arrive before anything happens. Her refusal is an example of autonomy, the patient's right to make decisions about her own body. However, her mother strongly disagrees. Because Maria is a minor, her mother insists that she gets to decide and demands that the surgery be done immediately. At this point, the healthcare team becomes torn between several ethical duties. On one hand, they want to respect Maria's autonomy even though she's only 17. On the other hand, as medical professionals, they are obligated to protect her and the baby from harm. This is where beneficence comes in, doing what is best for the patient, and also non-maleficence, avoiding harm. Delaying the surgery even for a few hours could lead to seizures, complications, or even loss of life. The situation becomes even more complicated with the issue of justice. In many healthcare settings, pregnant minors are given the right to make their own medical decisions despite being underage. So the medical team must balance fairness, legal guidelines, and hospital policy while also trying to de-escalate the emotional tension between Maria and her mother. Eventually, after being gently counseled by the nurse and doctor, Maria realizes the severity of her condition. Overwhelmed by fear but wanting the best for her baby, she finally agrees to emergency C-section. This moment shows how difficult ethical decision-making can be, especially when emotions, legal rights, and medical urgency collide. In this case or scenario, we see all four principles at work. Autonomy, Maria's right to decide. Beneficence, doing what is best for her and her baby. Non-maleficence, preventing further harm. And justice, following fair and legal standards for patient rights. So, thank you for watching. I hope this scenario helps clarify how principalism guides our actions in complex clinical cases. Together, may we continue to uphold ethical practice in every decision we make.